The oldest description of cancer was found in an ancient Egyptian textbook dating back to 3000 BC, according to the American Cancer Society. And even though researchers are constantly searching for a cure, there's another question that often pops up. Why haven't humans evolved to be able to fight this disease? Well, we kind of have. Tumor-infiltrating lymphocytes, or TILs, are naturally occurring immune cells that can recognize and kill cancer cells. Unfortunately, Dr. Joel Bean says they don't have enough numbers to truly fight off the tumor. In addition to these weaknesses, molecules on the surface of tumors called checkpoint inhibitors actively shut down these immune cells.
I tell my patients it's like a stiff arm in football, where the immune cells are there, but the cancer cells have a stiff arm up, preventing the immune cells from making the tackle or taking out the cancer cells.
Bean is a surgical oncologist and assistant professor at The Ohio State University. He says that while TILs aren't strong enough on their own, they shouldn't be overlooked as a treatment option. In the late 1980s, Dr. Steven Rosenberg discovered they could be an effective defense when paired with the chemical IL-2.
The first form of immunotherapy that he used was actually just giving that chemical IL-2 to patients. And he took him a lot of patients, but he eventually found a patient that responded to the IL-2. In other words, just the chemical that stimulated the body's immune system was able to activate those immune cells. Those immune cells were able to cause tumor shrinkage,
which sparked a long line of research that continues to this day. Now, instead of feeding patients just the IL-2 chemical, TIL therapy is more invasive but much more effective at strengthening the body's natural defense.
What we do is we remove that tumor with the T cells inside of it, and then we purify those T cells out and grow them up in a chemical that causes them to grow more, and it rapidly causes them to proliferate. And that chemical is called IL-2. It's a cytokine. It's a messenger that tells them to grow and grow and grow. And we grow these cells to really high numbers outside of the body, millions and millions of cells. And then we're able to inject those back into the patient for them to go and attack the cancer cells that are remaining behind.
After years of research, the FDA has finally approved TIL therapy as the first cellular therapy to treat patients with a certain type of skin cancer.
So it's specifically for patients with advanced or surgically unresectable or metastatic malignant melanoma. So there are other types of skin cancers, such as squamous cell carcinomas or basal cell carcinomas, that this therapy is not approved for. But there are currently trials studying it in a range of histologies, in a range of tumor types. I think the closest one to getting FDA approval will probably be lung cancer, which is very exciting. We've seen some dramatic responses in patients with very little options.
Patients like John Kosick, who participated in a clinical trial for this treatment after a surprise lung cancer diagnosis.
I had tendonitis in my shoulder from doing some lawn work, and I went to the doctor, and they took x-rays, and they discovered it through one of the x-rays. They happened to get a glimpse down into my lung, and they saw something.
Thankfully, they'd caught it early and were able to surgically remove the tumor. Kosick then underwent multiple rounds of chemotherapy to make sure all of the cancer was gone. Despite the successful treatments, Kosick didn't remain cancer-free.
They kept following it with scans. They saw the cancer coming back. There were, nodules increasing in my lungs. That's when I decided I wanted to do something different. I didn't want to just wait.
Kosick and his doctor searched for clinical trials that he'd be a good fit for and stumbled across one for TIL therapy at The Ohio State University. And while patients are only given one dose of the treatment, Bean says it's a much more intense process. After the initial operation to remove the tumor, purifying the T cells can take up to 45 days.
Once the immune cells have grown to a number that meets criteria, this certain threshold that we can give them back into the patient and them actually work, the patient's admitted to the hospital and the cells are shipped to Ohio State. And what we do to the patient is we lymphodeplete them. And in other words, we prepare them as a host to receive their cells.
Which means that patients are given chemotherapy that wipes out any and all immune cells in their body. The patients are then given doses of IL-2 and then the TIL dose right after. Bean says that since the T cells originated from the patient, they're usually tolerated pretty well. However, the doses of IL-2 that are given to continue to activate the immune cells once back in the body can be uncomfortable. In Kosick's case, the symptoms were fairly severe.
I got real bad fever and shakes. The worst part of it was after that, I got the IL-2. I think it was every 12 hours they did an IL-2. And they did that for, I think, 6 or 8 treatments of that. So that was like 3 or 4 days of getting IL-2. And those were just dreadful.
Kosick had a high fever and uncontrollable shakes that got so bad he strained a muscle in his leg.
But the worst part was the mental part, right? Because once you get through one, he's like, oh, I got another one coming back at 7 p.m. So you get through it, you got to get ready for another one.
Then, when Kosick was sent home, he experienced anemia for a few weeks. And though the journey wasn't easy, Kosick's once incurable tumor has shrunk so much that it's now undetectable.
Currently, they don't see any cancer in any of the scans, which, is awesome. My doctor says, if we keep this up for 5 years, that's when he'll say, I'm cured.
Which has been the goal of this treatment since the beginning.
When you look at Dr. Rosenberg's series, there are patients that have had, and these are patients that have widely metastatic disease. They've been heavily pretreated, but they get this one dose of TIL therapy and their immune cells, some of them completely go away and they stay away for 10, 20 years as far as we have data for. And so the goal is cure.
Unfortunately, it's not a cure for everyone. Current research shows that TIL therapy is effective in up to 50% of patients. And of those patients, only some will see such drastic results. However, it's still a big step from chemo or other targeted treatments that only slow the growth, not reverse it. You can find out more information about Dr. Joel Bean, John Kosick, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.